So this is fourth part of Omaima notes. Fourth part. So what is this? We have stopped here last time. Now, one Willebrand's disease affected factor, Web. This is factor 8. So it causes, helps the platelet. So one Willebrand's. Factor 1 is fibrinogen. So fibrinogen is converted to fibrin. This is converted to fibrin, which is factor 13. Prothrombin is factor 2. Prothrombin is converted to thrombin. Thrombin converts factor fibrinogen to fibrin. Fibrinogen to fibrin, and which is the insoluble fibrin is supposed to be factor 13. This is factor 13, last factor. Patient with on warfarin level INR should be 2 to 3. Heparin acts on thrombin. Actually it is antithrombin 3. Antithrombin 3. DIC factors, it is 5 and 8. These factors are consumed, factor 5 and 8. These are maximum consumed, not inactivated by antithrombin 3. This is the antithrombin 3 on which heparin combines with antithrombin 3 to stop the coagulation. It is an anticoagulant. Not inactivated by antithrombin factor, not inactivated by heparin. So heparin is acting through 8, 9, 10, 11, 12. So these are all factors from the intrinsics pathway. 12, 11, 9, 8, because 10 is last. So it is like this. These are actually that is sub AC heparin infusion. What is this AC heparin infusion? Bleeding. So side effect of heparin. If you give heparin, they can cause bleeding, alopecia, thrombocytopenia. Thromboprophylaxis for hip replacement. All this replacement, hip replacement, low molecular weight is the commonest and mechanical. Platelet undergo sigmoid colectomy, low molecular weight, mechanical. Platelet undergo knee amputation, low molecular heparin, pneumatic compression, stockings. Knee amputation. That's why there is no mechanical. Pneumatic compression stockings. Mechanical is not given because the patient cannot move fast. Patient with bilateral leg edema, recent flight, so move for 8 hours and on the slide, DVT is caused antithrombin 3 deficiency. So this is antithrombin 3. Heparin acts with deficiency and DVT, warfarin for life. When this deficiency is there, these are called thromboembolic phenomena. So that has to be prevented by warfarin. Back to UK after business meeting to China and extensive mobile femoral thrombosis, low molecular heparin, as it is not massive, means this is long flight. Patient is on warfarin, how to reverse? Patient is already taking warfarin, how to reverse? Prothrombin complex. This is an urgent reversal. Patient on heparin or protamine is the reversal. Patient is getting, for example, in CABG, heparin is given around 30,000 international units. It has to be reversed by protamine. Patient is a drug abuser, sign of overdose, how to reverse? So this drug is supposed to be morphine. So naloxone is given. Massive pulmonary embolism, unstable altipase, thrombolytic streptokinase, altipase. Patient is on unfractioned heparin, need to do surgery. So it can be stopped 6 hours before unfraction. Low molecular heparin, need to do elective surgery, stop 12 hours before. Patient is hypercoagulable plus develop pulmonary embolism, DVT, heparin, 7 days subcutaneously for 3 to 6 months. Warfarinization. Pulmonary embolism, knee operation predisposed by thrombocytosis, increase thrombocytes or increase platelets, Virchow's trade. Hypercoagulability. Recurrent pulmonary embolism, IVC filter. Blood components do not need matching. The cross matching is not required for platelets. Also fresh frozen plasma. Unless for pregnant or fetus. Uh, Blood components rise in gram-positive organisms. Blood, that can be gram-positive infection can be there because of platelets. Blood component cause risk of gram-negative is RBC. Okay. Patient given transfusion of fresh frozen plasma. Side effect urticaria can be there. Most common side effect of blood transfusion is fever. The patient doing getting transfusion develop arrhythmia, hyperkalemia. This can be due to transfusion contains low potassium is more. Patient did transfusion delayed reaction but no jaundice. So this is graft versus host. Immunocompromised patients and all that. Late complication of blood transfusion is jaundice, 2 to 3 months. Fracture femur and pulmonary embolism. Fracture femur, pulmonary embolism, petechial hemorrhage in the brain. What is this hemorrhage in the brain due to anticoagulants? It's not there. Came to for bleeding hemorrhoids. Hemorrhoids are there. Deranged INR, underlying liver problem, vitamin K. Massive transfusion increase 50p. It is DIC. Blood transfusion for massive bleeding 111 fresh meat RBC platelets. Post-operative hematemesis 3 units of blood and her blood pressure is still low. Upper GI endoscopy as a first step does not resolve. Go for laparotomy. Can't be used after 24 fresh frozen plasma. Patient on warfarin, INA is deranged. Operation. Okay, some points are repeating, no problem. Patient on warfarin, INA is deranged and need urgent operation. Prothrombin complex, fresh frozen plasma, and vitamin K. Shortness of breath after massive transfusion, fluid overload. White cells appear after 10 seconds of injury. Platelet. It is just like formation of platelet. Cells appear after 7 days is endothelial cells. Okay, this is the endothelial cell. Wound healing at 1 week, angiogenesis. Cells appear 10 days, myofibroblast. Stage of healing 6 weeks, remodeling. Factors may cause poor wound healing, infection, vitamin C deficiency, diabetes, steroids, anemia, jaundice. Keloid treatment is steroid injection. Burst abdomen, Bogota bag. Burst abdomen, negative, infected, Bogota bag. Patient had contracted finger wrist pronation. Fingers contracted wrist pronation. So this is hypocalcemia, Trozius or Chotek sign due to hypocalcemia. Patient had abdominal pain, renal stone, weak, depressed, bones, gland, it is hyperparathyroidism. Depressed, hypercalcemia, stone, bones. Patient with metastatic cancer, malignant hypercalcemia. Patient on antipsychotic therapy has hypercalcemia, low TSH, return to the normal, hypervitaminosis D. Motor accident, mid-thigh swelling, mid-thigh. After months, calcification found in the thigh, dystrophic. This is after trauma. Knee surgery, weakness, bone pain, abdominal hypercalcemia. Breast cancer, metastatic disease now present with hypotonia. Again, hypercalcemia. ECG with short QT, hypercalcemia. ECG absent T wave. Absent T and prolonged QT. Prolonged QT when calcium is decreased. Short QT, prolonged QT. Patient with acute pancreatitis, carpopedal spasm, hypo. Again, a calcium is decreased. Calcium decrease. Drug causes hyperkalemia, ACE inhibitors, spironolactone, potassium sparing, ACE, succinylcholine. Patient with corrected metabolic acidosis, hyperkalemia. Renal failure with hyperkalemia. Renal failure, increased potassium. First action is dialysis. Potassium is very much raised. ECG with wide QRS and tall T is hyperkalemia. 24-year male with profuse diarrhea, abdominal pain, hypokalemia. Diarrhea decreases potassium. High output fistula decreases potassium. Osteoporosis, normocalcemia. Osteoporosis, bisphosphonates, vitamin D, calcium. Osteomalacia, low calcium, high alkaline phosphatase. Osteomalacia, treatment vitamin D and calcium. Paget's disease, normal calcium, high alkaline phosphatase. ICU, weaning from ventilator, tracheostomy. Emergency mini tracheostomy, cricothyroidectomy. Acute management of gaining an airway, acute respiratory, put a needle in the cricothyroid membrane. Patient has head trauma 7 months ago, has history of ventilation, now got sudden hypoxia, tracheomalacia. Shows saturation of oxygen in your pulse oximeter. affected by perfusion, oxygen. Hypertension plus increased BP, bradycardia, heart block. Asthmatic attack, which type of ventilation? Positive pressure ventilation. Indication of ventilation, patient with respiratory rate more than 35. Child swallow coin stuck at the cricoid level, cricothyroid level. After trauma, patient has raised CVP, trachea shifted, tension pneumothorax, sternal fracture, organ damage, right ventricle, stab lateral to sternum, right atrium. So this is on the right side, above sternal angle, stab third intercostal space at the sternum, right atrium, superior vena cava. 70-year-old at high dependency unit, persistent high-grade fever after colectomy, pulmonary embolism. Pregnant patient, pleuritic chest pain, hemoptysis, pulmonary embolism. ST elevation will lead to infarction. Pregnant patient, chest tightness, acute dyspnea, myocardial infarction. Lab test for troponin. Patient with pancreatitis and diffuse pulmonary infiltrates. Pulmonary capillary wedge pressure normal, ARDS, when PCWP less than 18. More than 18, it is cardiac cause. Bilateral lung opacity or fracture femur, fat embolism. 30 years old, 24 hours after cholecystectomy, fever, lung atelectasis. Pregnant patient, sudden collapse, dissecting aneurysm. Patient with muffled heart sound, cardiac tamponade. Patient with hypoxia, subclavian central venous line. Tension pneumothorax. Patient post-traumatic rib fracture become hypoxic. Rib fracture is there, hypoxic oxygen, tension pneumothorax. Patient with pneumothorax after fluid levels, chest drain without suction. Hemothorax after trauma, chest drain. Flail chest, intubated suddenly, breathlessness, displacement of the tube. Road traffic is in patient with shock, IV cannula. Indication of ventilation, respiratory rate is very high within 6 minutes. Insertion of cricothyroid membrane, wide bore needle. Patient has ventilated long-term discharge, few months later develops stridor, tracheomalacia. Types of ventilation, positive pressure ventilation, respiratory failure, positive in intermittent positive pressure ventilation in respiratory failure, PEEP in ARDS and CPAP in asthma. Patient in ICU weaning from ventilation on CPAP, change CPAP to intermittent positive pressure ventilation. Normal which pressure is 11, ARDS is high, pulmonary edema, low, sternum fracture, right ventricle, chest drain, pneumothorax, fluid level, no suction is there. Bullet injury lateral to subcostal in the rectus abdominis, rupture gallbladder. Patient hypocalcemia, tetany, role of 10 mg calcium gluconate over 10 minutes. Least reliable for measurement is pulse oximeter. Pulse, PULSE, least reliable. Most reliable compartment pressure, no. Most reliable is pain out of proportion. Pregnant patient, rheumatoid heart disease, diastolic murmur, mitral stenosis. Patient had tension pneumothorax, what to do? Convert simple pneumothorax but needle decompression. Fifth intercostal mid-axial line. Then insert the chest tube over conversion. What cells happen after 10 seconds? Platelets. What cells? 7 days endothelial cells. 1 week angiogenesis. 10 weeks myofibroblasts. Poor wound healing, corticosteroid, radiation, vitamin deficiency, keloids, steroid, Bogota bag. The same is repeating. Came for bleeding hemorrhoids. Massive transfusion fibrillation, DIC. Orthopedics. Dynamics control, which MS is usually affected. Rotator cuff tear. This is rotator cuff tear. Which muscle is affected is supraspinatus muscle. Nerve supply to suprascapular. Patient with carpal tunnel syndrome is carpal tunnel release treatment. Patient walking downhill improves with cycling uphill. Spinal canal stenosis. Tenor of disc prolapse. Numbness over the medial aspect. Lesion is L34 is femoral nerve. Patient complains of the pain at the end of day. Facets spondylolisthesis. Loss of lumbar lordosis is spondylolisthesis. Bilateral sciatica central disc. Outpouching sacral region, sacral content meningomyelocele. Outpouching meningeal content meningocele. Extensors on the gluteus maximus, if not present, semitendinous, semimembranous. Patient with painful hip with a long history of rheumatic arthritis, avascular necrosis. Valgus test positive, medial collateral. Varus test, lateral collateral. Knee joint with medial joint space tenderness, medial meniscus tear. Tender lateral joint, lateral meniscal. Positive anterotropes, anterior rupture, Lachman test. Posterior sagging, posterior cruciate, slow growing, painful, slowly growing, painful lateral knee swelling, medial meniscus. 45-year-old with posterior knee swelling. Swelling is disappeared, appeared in the calf, rupture, Becker cyst, no history of trauma, sudden lock knees, loose bodies, history of trauma, lock knee, medial side tenderness, medial meniscus tear, tendon localization, Simmons test, 10-year-old history of medial mid-tarsal fracture, presents now with the midfoot, osteoarthritis, lateral malleolus fracture. Which tendon is most likely to be injured? Peroneus brevis, lateral malleolus. Two most common ligaments with ankle sprain injury, anterior talofemoral and calculofemoral, Morton's neuroma, histology, perineural fibrosis, painful forefoot, X-rayed, faint, callus, no history of trauma, athlete, stress, fracture. Sinus tarsi is present between talus and calcaneus. First metacarpal narrowing joint space, subchondral cyst, osteoarthritis, cyst, scone lesions. Bony lesion at the lower metaphysis and femur plus fracture in 12-year child. Osteosarcoma, lower metaphysis. Codman triangle, sundry appearance. Knee pain with radiolucent swelling extending to the joint line but doesn't destruct the giant cell tumor. Osteoid forming bone form in the young child, osteosarcoma. After fixation of the fracture, patient feels pain with the toe extension, compartment syndrome. Pylon fracture, distal end of the tibia, where you will put external fixator, tibiocalcaneal. Pylon. Patient had fracture, did fixation, and then complication, shiny skin. This shiny skin is regional pain. Patient femur did surgery and after operation develop absent pulse, reopen and explore. Patient fracture 8 hours operation, absent pulse, investigate CT. Patient has perfringent gout type. Presentations like pseudo gout. Patient has gout, open fracture of long bone. How to do fixation? External fixator, open fracture, external. Management of hip fracture. 40 years old patient, displaced subcapital fracture, cannulated screw. Young patient. Old patient, displaced is to hemiarthroplasty. Old patient, displaced fracture, arthritis, total hip replacement. 60-year patient with patient history of rheumatoid arthritis, fracture, pathological fracture. Hit trauma from the side, transverse fracture. Twist fracture is spiral fracture. Pathological is transverse. Fracture in the child is green stick. Colles fracture, patient is limited pronation and supination, malunion. Trauma to the wrist, no fracture is seen. Scaphoid. Fallen, outstretched in parasessia, medial nerve distribution, lunate dislocation, pain, swelling in the mid thigh. Patient has external rotation, absent distal pulse, shaft fracture, hip pain, internal rotation of the foot, posterior dislocation, cancer, breast, subtrochanteric fracture, base management, intermedullary learning. 40-year-old man displaced subcapital displaced 40-year cannulated screw. 80-year hemiarthroplasty, fracture in the distal radius, splinting. Management of the subtrochanteric intermedullary nail. Management of intertrochanteric, subtrochanteric, below the trochanter, intertrochanteric, unstable, intramedullary nail, stable is dynamic hip screw. Management of olecranon and patella. Management of olecranon patella tension bands. Potts spine or if Potts fracture. Potts fracture by malleolar fracture. It is two malleolus, inverse two malleolus. So open retraction, internal fixation. Pylon fracture, internal medullary fixation. Callus. Comminuted fracture, external fixation until or if deep DDH. So development dysplasia of the hip joint, transverse synovitis, Perthes, septic hip, and Scoofy. Sophie is obese. This is transient synovitis, history of respiratory infections. DDH is Ortolini Barlow's test, and even skin crease and congenital dislocation of the hip. Perthes is painful hip joint, age is 6 to 8 years. Septic is history of fever. The Scocker's criteria signs are there: fever, WBC count raised, and all that. Osteoarthritis versus rheumatoid arthritis. This is rheumatoid arthritis, ulnar deviation, anterior cord syndrome, central cord syndrome, posterior cord. Anterior is the motor, central is the upper extremity more affected, posterior cord syndrome is sensory. Intermittent claudication, IBP 0.5 to 8, rest pain severe is less than 0.3 to 0.7, aortic aneurysm 4.7, management ultrasound, aortic aneurysm, other scenarios, rupture and all that. Post-operative, patient has urine. Post-operative patient has urine problem, post-operative acute renal failure due to reduced perfusion. Very important after operation, aortic got urine retention, anti-spinal occlusion. Popliteal aneurysm 3.5, conservative, Leary syndrome scenario, bilateral claudication with erectile dysfunction, fracture femur with pale limb. Fracture femur, pale limb, explosion of the femoral may be vascular compromise. Black toe plus aortic aneurysm is embolism, that is trash foot. Black toe, diabetes, small vessel disease, tightness in chest, pregnant acute myocardial infarction, hemoptysis in pregnant pulmonary embolism. Post-operative, patient got abdominal pain 1 hour after eating and improved when he is lied down. Mesenteric angina. Immediately after, acute intestinal ischemia. Acute intestinal ischemia, embolism is acute intestinal. Post myocardial infarction, patient develop ischemic leg. This is again embolus. Patient has bilateral leg swelling after long flight is DVT. Patient antithrombin deficiency, lifelong warfarin. Heparin won't work due to factory. Patient back to UK again, massive since patient again, low molecular heparin. Now these are questions of GI surgery. Dysphagia, unable to relax lower ecclesia cardia, CA esophagus squamous cell carcinoma. In ecclesia squamous, in Barrett's it is adeno. Best investigation barium swallow, GERT best investigation pH monitoring, and 3 hours history of GERT now has progressive dysphagia, diagnosis of cancer esophagus. 3 years history of GERT, now progressive dysphagia. 50 years man with squamous cell carcinoma in upper 1/3 of esophagus, no metastasis. Macneon esophagectomy. Ivory esophageal structure is divided to allow mobilization is ischias vein and long-standing Barrett's with long-standing dysphagia. Treatment is Ivory esophageal. Long-standing Barrett's with long-standing cancer T1 1 centimeter. Endoscopic. This is limited to mucosa endoscopic. Obstructing esophageal carcinoma spreading to mediastinum is stenting. With obstruction is stenting. Stricture is stenting. Patient with esophageal stent now complains of acute dysphagia, stent displacement, migration. Patient dysphagia, candidiasis after gastric bypass, feel dizziness is the dumping syndrome, early dumping, late syndrome. Lynch syndrome is associated with the gastric carcinoma plus colorectal carcinoma. FAP is associated with the duodenal carcinoma. Fabinal adenopolyposis, duodenal carcinoma, colorectal. Lynch with the gastric carcinoma. Patient with Lynch syndrome has history of CA colon, now presented with obstructive jaundice, gastric carcinoma. Patient fundic carcinoma, to which lymphatic celiac axis. Patient lymphoma, now non-Hodgkin lymphoma. Gastric lymphoma is non-Hodgkin. Hepatomegaly in Kwashiorkor. What is the cause? Fat infiltration. 5-week history of liver failure. Patient has high INR. Deranged liver function. Which type of hepatitis? Drug-induced hepatitis. Progressive deterioration of liver function. Histopathology shows portal, periportal infiltration, lymphocytes, plasma cells, macrophage. Diagnosis: chronic active hepatitis. Cause of hepatocellular carcinoma: viral B and C. A risk factor of hepatocellular carcinoma, then viral hepatitis, alcohol, aflatoxins. 34-year female, colic upper abdominal pain since 3 days, radiating to the back and no jaundice, temperature, acute cholecystitis. 43-year pain radiating to the tip of the right shoulder, blood in this next step is ultrasound. 41-year female, colic upper abdominal, gallstone by ultrasound, next liver function. 68-year male with a feature of hepatic septic shock and right upper abdominal and no jaundice and A calculus, diabetic patient if suppose shock is there. 43-year female has symptoms of fever, jaundice and sepsis. Fever, jaundice, sepsis, ascending cholangitis. Post cholecystectomy pain, shifting, pain is shifting, biliary peritonitis. Open cholecystectomy patients suffer painless jaundice, dilated common bile duct, ERCP. Increased conjugated bilirubin, obstructive jaundice, hemolytic jaundice, unconjugated prehepatic. In obstructive jaundice, stool is pale and offensive due to decrease intrahepatic circulation. Young patient with indirect hyperbilirubinemia jaundice is Gilbert syndrome. 19-year Corsican girl Corsican spherocytosis, yellow gallbladder, cholesterol stone. Black stone is pigmented because of hemosiderin, iron, and brown is infective. Inferior epigastric vessel is direct. Inferior direct hernia is medial to inferior vessel. Indirect hernia is lateral. So this is medial, this is lateral, indirect. Above and medial inguinal, below and lateral femoral. Below lateral femoral, above and medial inguinal. Medial to femoral hernia. What is there now? Femoral hernia. Medial is lacunar, lateral is femoral vein. Lateral is femoral vein, medial is lacunar, posterior is posterior to femoral ring, anterior is inguinal, posterior is pectineal. To strengthen posterior wall angula, what do you repair? Pectineal ligament, known as in this. Ingrowing toenails are called swelling on the groin. Rhinopathy, nerve injury after gridiron incision, ilioinguinal nerve. During inguinal hernia surgery, local anesthesia, which nerve, femoral nerve injury may cause, pay attention, not ilioinguinal nerve. Femoral nerve injury can occur. Multiple gallstones, multiple hemolytic, unconjugated hemolytic, anti-mitochondrial antibodies, biliary cirrhosis, patient with ulcerative colitis, rheumatic pain, complicated PSC is there, pancreatic arterization is trypsin, most specific equipment, lipase, chronic pancreatitis, fecal elastase, steatoria due to decreased lipase in chronic pancreatitis, steatoria, lipase. Lady with weight loss, progressive jaundice, 3 months, cancer head of the pancreas. Jaundice plus smooth upper abdominal mass, cancer head of the pancreas. This Coverge's law, localized carcinoma of the head of pancreas, Whipple's pancreatidotomy. Cancer head of the pancreas, no metastasis, Whipple cannot be done, then metallic stent. No metastasis, Whipple's can be done. Cancer head of the pancreas with obstructive jaundice, ERCP and stent. Spleen that contains macrophages, histiocytes. Pernicious anemia antibody against which type? Parietal cells. Patient with parietal cell problems, impaired vitamin B12 absorption, loss of intrinsic factor due to deficiency. Patient is pregnant, give her folic acid. Pernicious anemia, which type? Macrocytic. Atrophic gastritis, Finland, macrocytic. Come back from the Italy, huge splenomegaly, Epstein-Barr. Splenectomy ligation is short gastric. Fundus. During splenectomy, ligation of short gastric, the fundus is affected. Post splenectomy, CBC will show increased platelets and Howell jolly bodies. Post splenectomy, increased lung opacity, there is streptopneumonia. Prophylactic splenectomy against streptococcal pneumonia, H. influenza, nasal meningitis. 50 years old, new malabsorption is celiac disease. Bloody diarrhea after anal fistula, Crohn's disease. Ulcerative colitis, high grade fever, distended colon, toxic megacolon. Young adult, bloody diarrhea, low grade fever, weight loss, colonoscopy, friable mass, mucosal ulcerative colitis. Female abdominal pain, contrast for small intestine is going from ileum to the ascending colon and sigmoid, then stopped. Ulcerative colitis in sigmoid. Mass in the left iliac fossa with diarrhea, bleeding, and weight loss. Crohn's cancer colon. 65-year-old man presented with weakness in limbs. No other clinical findings. CA rectum. As it also with the brain metastasis. Weakness in the limbs. Okay. CA colon with lymph node metastasis. Duke staging 5-year survival is 30%. This is stage Duke C. Lymph node metastasis there. It is 30 to 50%. TNM staging of confined to mucosa not involving muscularis propria, it is T1, and lymph nodes 2 means TN1. T4 colon cancer involving surrounding abdominal musculature. T4 means surrounding, not abdominal musculature, surrounding structures. Which type of stoma is usually done in the Hartmann procedure? End colostomy. Pan protected type of stoma is end ileostomy. Right colonic flexure obstruction. A patient has ileo cecal wall plain plan resection, CA colon and liver metastasis chemotherapy, CA colon plus positive CA colon liver metastasis. CA colon with liver metastasis treatment is chemotherapy. CA colon plus positive familial adenosis polyposis. This is familial adenopolysis. Panprotectomy. Right iliac fossa pain with low grade fever, WBC 13. Urine analysis shows leukocytes, diagnosis appendicitis. Abdomen USG shows matted sound, thickened appendix, IV antibiotics, management of the high output fistula in Casimir syndrome, octetroid, 55 absolute constipation is sigmoid volvulus, recurrent UTI, pneumo is vesical fistula, bright red bleeding, painless defecation, hemorrhoids. Painless hemorrhoids, painful is fissure. Painful is fissure, diltiazem is for the fissure, irreducible is hemorrhectomy, numb in the rectum after lifting perianal hematoma, perianal abscess treatment incision, anal discharge after inflammatory mass, internal opening rectum, anal fistula, head and neck surgery structure that are related to the middle ear is facial nerve, middle ear, facial nerve, chorda tympani, head trauma, patient present is 1 week with zygomatic arch, elevation fluid coming out from the ear and hearing loss, pittus part of temporal bone. Ideal incision for submandibular gland is transferred 2 to center below bilateral pituitary gland, dry mouth plus bilateral facial palsy is sarcoidosis. 50-year-old use 50-year-old with disused swelling in the region of right parotid, facial nerve palsy, and adenocystic carcinoma. Lady with dry eyes, Sjogren, solitary thyroid nodule. Females, thyroid pulsatile forehead, follicular margina with cervical lymph node is papillary. Thyroid mass with paroxysmal headache is medullary, part of Mann syndrome. Goiter, hoarseness, stridor, anaplastic. Thyroid nodal investigation choice is FNAC. Surgeon found thyroid nodal accidentally. Best action is frozen section. Papillary thyroid less than 0.5 centimeter. No lymph node. Treatment is hemithyroidectomy. Patient has trauma, lucid interval, extra hemorrhagia due to middle meningeal artery or temporal head trauma, size of the lateralization, sudden rapid deterioration, acute subdural hemorrhage. Head injury, blood in CSF, subdural hemorrhage, head injury, blood in CSF, massive hemorrhage, subarachnoid hemorrhage, alcoholic history, subdural hemorrhage, alcoholic trauma, subarachnoid hemorrhage, marathon runner suddenly collapse, subarachnoid hemorrhage, preterm baby, intraventricular hemorrhage, road traffic accident, rapid shaken baby injury, diffuse axonal injury, center of brain tumor in the adult is glioma, 2 centimeter papillary carcinoma located into one lobe. Treatment is total 2 centimeter, more than 1 centimeter. Okay, total. Treatment for medullary thyroid carcinoma, total thyroidectomy, post thyroidectomy, tingling, numbness, hypocalcemia, post thyroidectomy, swelling, aspiration, negative language, seroma. For medullary thyroid carcinoma, calcitonin, thyroid storm. Treatment is beta blockers and thianomides. Why it is important to exercise thyroid? Because of infection. Best patient on the warfarin with the typical signs on the aspiration, say hemorrhagic cyst. Precis aspiration shows no blood, no collection management, no further follow-up, multiple bilateral cystic swelling, premenstrual fibroadenosis, fat necrosis, trauma, mobile mass, upper quadrant is fibroadenoma, teething is the cancer, 65-year unilateral guy, weight loss, cancer, male breast, crusting eczema, Paget's disease, how to differentiate tender swelling of the breast, inflammatory carcinoma, inflammatory, no response to antibiotics, inflammatory, female patient with breast cancer, lymph node, you will get biopsy, sentinel lymph node, most appropriate, 2 centimeter patient, 2 centimeter 40-year-old is true cut biopsy, eczema from the nipple and areola. Next is punch biopsy, cancer of the breast, HER2 positive, trastuzumab, metastatic breast cancer, chemotherapy, good prognosis, HER positive, HR negative, 7-year boy, soft renal gas, a normal test is fine, urosurgery, stone in the renal place is pain, we refer to T1 to L1, calcium oxalate is the most common, primary management of renal stone, 0.7 centimeter is hydronephrosis, PCNL, infection is there, PCN, percutaneous nephrostomy, 1 centimeter ureteric stone, no obstruction, hydronephrosis, ESWL, 70-year-old female, spontaneous urine retention, local heat replacement, bladder neck inactivity, fracture pelvis after trauma and distended bladder, rupture urethra, male urethra with the urine retention 3 months back and no urethral stricture prostatitis, pathology of hyperplasia, 70-year cancer prostate, PSA 300, obstructive urinary hormonal treatment. Treatment of metastatic cancer prostate is radiotherapy plus androgen suppression, bisphosphonates. Following prostatic operation, patient is hypotensive, confused, and agitated, dilutional hypoirrigation. Lupus nephritis is autoimmune disease. Pelvic trauma with child cycling, falls leg apart. This is rupture of the bulbar urethra. Patient did vasectomy. This is sperm granuloma. Dragging sensation, bag of worm is varicocele. Pelvic injury in anterior side, high riding prostate is membranous urethra. Painful testicle, absent cremastic reflex, torsion testis. Painful testicle, present reflex is morgagni if it's a small patient. Urgent to pass urine fall in the in bladder rupture. Fracture pelvis, distended bladder, urethral injury. Pyonephrosis, Pyelonephritis scarred small kidney cause obstruction. Hydronephrosis, aseptic dilation of the kidney, infected become pyelonephritis. High creatinine, history of diabetes 1, renal perfusion, enlarged prostate pathology, hyperplasia, nutcracker syndrome, compression of renal and mesenteric gland between this, that is nutcracker. 18 years swelling in the testicular transillumination had not to be failed, had transillumination, testis, hydrocele, jabulis repair, Lord's repair, transilluminate, and could feel the testis and epididymis, does not translimate feel the hematocele. 10-year boy sudden onset testicular pain, renal testicular exploration. 42-year hard lump, irregular lymph node, cancer of the seminoma, orchidectomy, radiotherapy, radiosensitive teratoma. 20 to 30 years lymphoma, more than 62 days history of painful testicle with urinating, erythematous tender and urine dipstick shows WBC, orchitis infection, sexual active gonorrhea and non-sexual active chlamydia. 30-year-old heart tumor, teratoma, orchidectomy, inguinal approach. 30-year painless hematuria, 1-year non-smoker due to brain bleed, polycystic kidney, Berry's aneurysm, rupture is called subarachnoid hemorrhage. Sign cancer, frank hematuria, smoker, bladder cancer, transitional cell cancer, Egyptian long transition, squamous cell carcinoma. A long pain radiate to the groin is renal stone. Pain in the suprapubic region, bladder stone. Hesitancy and all this is a prostate. Hematuria, weight loss, mass, left varicocele, erythropoietin high, probability of renal cell carcinoma. You see varicocele, do USG for pelvic cancer. Left testis swelling does not transmit. You get above, despair, lying down is varicocele. Treatment, testicular swelling transmit and you get above and cannot palpate testis is hydrocele. Female swelling below lateral to the thigh is FNS varix. If pulsatile femur strangulation mass, patient mass tethering to the skin. Child with painful testicular swelling, viral mumps, orchitis. 87 prostate cancer surveillance, active surveillance. He do patient do radical prostatectomy, high if symptomatic Gleason score, do hormonal therapy. 57 cancer prostate afraid of developing impotence, do radiotherapy, no brachytherapy. Patient with prostate cancer, back pain, Gleason score high, no go, not there, go hormonal therapy. Old age, poor stream, smooth prostate, dribbling urine at end of fictional PCA, give finasteride. Not helpful. Patient BPH, TURP now. Bladder neck stenosis, complication of TURP. 22-year hit by 22-year hit by the car. Microscopic hematuria, BP pulse normal, CT scan. 74-year acute suprapubic, inability to pass urine, bladder palpable 6 cm above the pubic. Patient has urine retention, Foley's catheter. Patient cycling fail, inability to pass urine, urethra, stridal injury, maybe urethral injury, bulbar, antegrade ureterogram. It says high riding prostate is membranous urethra, 6 mm stone, vesicular junction, cystoscopy, retrograde, UV junction. So no matter in size, remove it. Patient loin pain, hydronephrosis, BP is high, percutaneous nephrostomy. Patient cancer, suspicion of frank hematuria, 3 days, suprapubic discomfort, inability to pass urine. There is managed hematuria. Patient loin pain, severe rotating to groin, microscopic 4 mm stone, analgesia stone less than 5. Patient has loin pain, 1 cm stone, ESWL. Did DAMSA for stone, 10% function, nephrectomy is the treatment because function is not there. Patient has palpable bladder, does not pass urine, Foley's catheterization. Suprapubic palpable urine, not pass urine, hematuria, Foley's catheter. Palpable bladder, no urine, Foley's inserted, failed many times, no hematuria. Patient is old, dysuria, terminal dribbling and dull percussion, prostate cancer. Female patient, burning sensation, urination, tenderness, suprapubic pain, cystitis. Bag of worms, varicocele. 1-year boy, nappy. 1-year boy, fever, blood in the nappy, mass in the left, weight loss, Wilms tumor, nephroblastoma. Patient is old, UTI on lab, on old patient, hematuria, renal adenocarcinoma, treatment by nephrouretectomy, ileal conduit. 20-year old of antecedent testis, teratoma. Patient was fine post surgery, catheter 320, block catheter. 2 years birth, leak, cuff snake, stress continence. pelvic floor exercise. Patient has mixed urge incontinence, urodynamics. Patient has loin pain, wide urinary, vesicular reflex. Standard treated urinary flow is reduced urethral stricture. 35 painful frank immature transitional cell carcinoma. Neonate with the urine posterior urethral walls. Patient dorsal penis injury EPDS. Ventral is hypospadias. Swelling comes and appears childbearing indirect inguinal hernia. Head injury with lucid interval GCS 15 becomes 7 undilated middle meningeal. Head injury with right side GCS decrease. Patient pupil dilate fixed with surgery to prevent parieto-temporal craniotomy. Head injury with signs of lateralization, rapid deterioration, acute subdural hemorrhage. Head injury, some blood in CSF, subdural hemorrhage. Male patient alcoholic, homeless, acute subarachnoid hemorrhage. Marathon runner, sudden death, subarachnoid hemorrhage. Patient with subarachnoid hemorrhage, urine output, diluted urine due to inactive antidiuretic hormone. Syndrome of diluted urine, high content. Preterm baby, floppy, intravesical hemorrhage, intraventricular hemorrhage, high speed car accident. Patient has rapid onset of loss of consciousness, no signs of trauma, diffuse axonal injury. Head injury, Glasgow coma scale, neurosurgery referral, old age, repeated vomiting, immediate CT scan. 60-year alcoholic patient, known case of head trauma, small eyebrow wound, observation. Patient has left lower limb paralysis, anterior cerebral injury. Patient has nystagmus and ataxia, pica injury. 45-year male with his headache, associated nausea, vomiting, especially in the morning. Papillodema, frontal glioma. Patient after head trauma find that deteriorated extradermal hematoma, lucid interval rupture MMA from superficial temporary T-bone formed by the partial frontal bone and sphenoid bone, lateral bone. When to send patient to immediate CT scan, less than 13, deterioration less from after 2 hours, more than 1 episode of vomiting. When to contact neurosurgeon, patient Glasgow coma, less than 8, unexplained confusion, penetrating injuries of depressed skull. Organ transplantation. What is the other important marker for transplantation of ABO? HLA-DR. Patient has dog bite, nose tip debridement, healed by secondary intention because contaminated. Kidney transplant from identical twin, isograft. Skin autograft. Patient take organ from the cadaver, allograft. Porcine skin graft, xenograft. Patient has rejection within minutes or hyperacute rejection due to mismatch. Renal graft rejection after 3 months is acute rejection. Patient has transplant signs started after 6 months chronic rejection myointimal. Patient has renal transplant 4 weeks, 6 months post transplant cytomegalovirus. Patient renal transplant more than 6 months. Less than 6 months is cytomegalo, more than 6 months is Epstein-Barr virus. Acute rejection is mediated by which type of cell is T lymphocytes. Dermatology, scar with ages, hypertrophy. Within the age is hypertrophy and beyond is keloid, and eczema is ectopic, scabies is itchy, dome shaped with keratin is keratoacanthoma, velvety red lesion, keratin, squamous cell attention, squamous, itchy forehead mass over 1 year, squamous cell, mediastinal mass with keratin, squamous cell carcinoma, fungating mass, squamous cell carcinoma, purely white ages, basal, painless ulcer, no cervical lymph node, basal, patient because nose removed, she is back with a basal. Old age pigmented lesion over the torus, malignant melanoma. Patient leg ulcer is inguinal lymph node is malignant melanoma. Melanoma in situ excise 1 cm margin, education self-examination, brown spots, cephaloid spots, neurofibroma type 1. Soft tissue swelling in the back, rubbing stenosis, lipoma. Post-operative care, patient hot skin is seroma. Punctum lesion is sebaceous. Best prognostic factor melanoma is low thickness. Best prognostic factor of basal carcinoma, lymphoma, lesion, red brown, trauma, ulcer like skin irritation, 1 centimeter lacerated on the scalp. Treatment is primary closure, large scalp defect, rotational flaps, dog bite, part of the nose, debridement, let it heal by secondary intention. Ulcer on the heel, debridement, heal by secondary intention. Venous ulcer not responding to compression bandage, 12 weeks, partial thickness graft, 3 cm on the tibia exposed, pedicle graft from gastrocnemius, 3 cm on the tibia, bone is not exposed, split graft. Boy comes with the forearm wound due to boiling water, leave blister as such. 5% painless dry, 5% dry painless burn on the abdomen, simple occlusive tracing. 20% thickness, more than 20% deep burn in the mesh split graft. Reconstruction after breast surgery, regional flaps, myocutaneous erythema. Patient is a cancer on the nose, 1 centimeter or remove and local flap. Soldier squamous cell carcinoma of the cheek, remove, debridement of the wound.